A huge luxury that nobody talks about is running pain free in your 40s. Not a car, not a watch, just knees that still work. I'm Dr. Ray Peralta, a physical therapist, run coach, exercise physiologist, and over the past 10 years, I've helped hundreds of runners, including those in their 40s and beyond, rebuild their stride, erase different types of running injuries, including even chronic pain conditions, and run stronger than ever without pain pills, injections, or surgery. In this video, I'm going to show you exactly how to run pain free in your 40s. Even if you've been dealing with things like IT band syndrome, runner's knee, shin splints, Achilles tendonitis, or just feel like your body doesn't recover like it used to. I'm going to walk you through 7 key tips that I teach my clients to stay healthy, mobile, and pain free so you can keep running for decades. And if you want to go deeper, I've got a free 5-day course that breaks down everything I covered today. I'll link in the description. And in that course, I'll cover the fundamentals of injury free running, and you'll learn exactly how to structure your training, recovery, and strength work to stay pain free. So, tip number 1, recovery centered or focused training, right? Most runners in their 40s don't get hurt from running too much. They get hurt from recovering too little, not enough recovery. See, you don't need to run 6 or 7 days a week. You can if you really want to, but most folks find that if they're injury prone, that's just a recipe for getting injured. I'm not saying you can't do it at all, but if you're injury prone, consider just doing 3 runs a week. Quality runs, right? One long run, one tempo run, one easy. It depends what you're training for, right? If you're just training for general fitness or general health, you just can do the same easy, moderate workout 3 days a week for your running. Right? It could be like a 30-minute vigorous, moderate to vigorous exercise or an easy run. But if you're training for like a marathon or a half marathon, obviously you want to do a long run, then a tempo run, and then some speed day. And that's more than enough for most people. But you're like, but wait, that's not enough. You'll do 2 days of cross training, right? That could be biking, swimming, rowing, elliptical. And the cross training could be like 30 minutes, 45 minutes. Like, right, it could kind of mimic one of your run workouts, but you're doing that on a bike, or now you're doing it in the swim. Like the same amount of time it would have taken you to run, you're spending that time biking, right? So now at the end of the week, you're still getting your cardiovascular exercise, except a part of it was done with cross training and it's less stress on your body. The next thing is sleep. Sleep is your secret weapon. So many people are sleep deprived. Aim for at least 7 hours a night. Some people might need 8 hours a night or more, but at least 7 hours, right? Because poor sleep equals poor recovery, right? And that's going to increase your risk of injury. And if you're returning to running, start small, right? When it comes to running, it's okay. Oftentimes, I actually teach people you don't have to do these training plans that has you running 6 days a week. If you're like coming back after a long break or you haven't ran at all, like you're a complete adult beginner, maybe start with just 2 runs a week, right? Have like 2 or 3 days in between, and then walk daily until you could walk comfortably for 3 miles. And once that's easy, maybe you add a third day of running, right? And then you do that for a few weeks. And once you adapt, maybe you could go to a fourth day if you want to. If not, I tell most people just stick with 3 days a week of running and then 2 days of cross training. See, one of my clients, Mike, a 43-year-old dad, couldn't get past, more than 15 miles a week without like a knee pain started to flare up. But once we switched to 3 runs per week, prioritize sleep, doing cross training, he was able to train for a half marathon. He finished his half marathon pain free without having to like run, 5 or 6 days a week. He was able to do it. Then he finished under 2 hours as well. He finished a half marathon under 2 hours with just 3 runs plus 2 cross training. Tip number 2, strength training. Right? Running is essentially a series of single leg hops, right? So single leg strength training is everything. You could train double legs as well, right? So for example, the squat, you could train squat with 2 legs, but also train squat with 1 leg, single leg squat. You could also do split squats. So 2 times per week, you're gonna do things like split squats, deadlift, single leg deadlift, step down, step ups, calf raises, single leg calf raises, sideline hip abduction, or even standing monster walk or standing hip extension. So if you're busy, just do 1 set to fatigue, right? 8 to 12 reps. Right. One that's going to be more time efficient. Right now, you could do a full body strength routine in like 20 minutes or so, 20, 30 minutes without having to spend hours in the gym. And also, you'll have more energy left in the bank. So you're not wasting all your energy strength training. So now you could have some energy left over so you could run. Now, some people may kind of push back, but you don't get it. I love to strength training. fine. If you love to strength training, you can. Now you just know you're going to take more time to recover, right? So if you're doing multiple set routine, right, training like a bodybuilder, maybe doing 3 sets, 6 sets, you could do that, except now you're going to take away time from your kind of recovery bank now because you're taking some energy away to recover from strength training. Now it's going to maybe put you overly fatigued and potentially put you at risk for just overuse injuries, even though the fatigue happened from strength training. So instead, do your strength training smart and efficiently, 1 set to failure, 1 set to momentary muscular fatigue, 8 to 12 reps. You can vary the reps a little bit up and down, but for the most part, you just do a single fatigue. Yes, you can do warm up sets. That's fine if you want to warm up. But again, the main set should just be 1 set to fatigue. You don't necessarily have to do multiple sets unless you really love lifting. You can, but for the most part, just be time efficient. You'll still get the benefits of strength training without having to spend hours in the gym. Tip number 3, mobility training. Mobility keeps your joints moving and your muscles happy. But most people, they stretch too short. Maybe they do 10-second stretch, 30-second stretch, and they're like, oh, okay, forget about it. No, you want to stretch at least 90 seconds, or even up to 3 minutes, or even 5 minutes, right? So this might look like if you're doing calves, for example. Everyone knows the runner calf stretch where you're standing, one leg's back, extended, with the foot, pointing forward or so. People do that for 30 seconds. No, you're gonna do a minute, 3 sets of a minute, right? So 3 60-second holds, 3 minutes, right? Or even 5 60-second holds, 5 minutes, right? Per side. If you're tight or stiff. The key is focusing on your tight or stiff areas. Not everyone's gonna have the same tight or stiff areas. This way you can save yourself time. Instead of stretching every single part of your body, you're just gonna focus on the areas that are typically tight on you. For example, I know myself, I'm like tight in my upper back, so I have to work on a lot on my thoracic mobility and also hip flexors a lot of times. And again, as a general rule, not every single one's going to be tight in the same area, but most people I work with are tight in their hip flexors. So you may want to do a hip flexor stretch or the couch stretch where you hit your hip flexor and your quads at the same time. And then again, 3 by 1 minute holds. So you get at least 3 minutes. I'm going to go more with the 3 minutes versus just 30 seconds because 30 seconds is not enough. Yes, if you're pressed for time, you can do it as part of like a circuit of like a dynamic warm up, right? You could do kind of active versus static or passive stretching, but for the most part, you still want to do some mobility work, either on its own separate occasion or after your workout for static stretching. And then foam rolling is very beneficial. So you could foam roll tight areas as well, right? You could foam roll the T-spine, you could foam roll your hip flexors, your quads, you could foam roll your calves, or you could do lacrosse ball on the bottom of your foot, lacrosse ball, your plantar fascia. So the foam rolling or lacrosse balls kind of do like self-massage. We can also help decrease like risk of like potential plantar fasciitis or developing like a runner's knee, just because now you're making sure the tissues kind of move or glide a lot easier around those joints. Uh, Tip number 4, foot and ankle focus. So many people, they made exercise for the foot and ankle, but some special mention should be put here, right? Because your foot is your foundation. So train it smart. So try these. One, you don't have to run barefoot, but at least do some of your warm up barefoot if possible, or at least indoors where you feel safe. Do some barefoot exercise because barefoot training trains strengthens the muscles underneath your foot, these small little foot intrinsic muscles, right? You could do something called toe yoga. We could alternate lifting the big toe, little toes down, back and forth. You could do little towel curls, strengthen the bottom of the foot. You could walk on your tippy toes, walk on your heels, barefoot calf raises, barefoot toe rocks, just walking barefoot forward, walking barefoot backwards, dragging a sled while barefoot. So barefoot training could be such an important thing. And so many people overlook this barefoot training because they think it's not safe or it's dangerous. You can start small, right? Just 5 minutes of barefoot walking or 5 minutes of barefoot drills, and then you can put your shoes on and go back to doing your standard programming with your running shoes or your gym trainer shoes, right? So as far as shoes or footwear goes, right, you want to inspect your foot, make sure, hey, you're not getting any blisters or whatnot. If so, you may need to get special toe socks or toe spacers to help spread out your toes, or even a shoe with a wider toe box. Further, when it comes to the running shoe, your shoe should be comfortable. So test it out, make sure your running shoe is comfortable, and also rotate between pairs of shoes. Or at least you have 2 pairs of running shoes that you're rotating to, so you're not always using the same pair. And then it's when you kind of prolong the life of the shoe, and also it's better, easier. So that as your shoe, because when you're using the shoe, it deforms, but you want to give it a little kind of breathing room to kind of help kind of regain its shape, and then rotate it with another pair of shoes. And then every 6 months, 2 years, you should be getting a new pair of running shoes, regardless, depending on how much mileage you put on it. You can look at the manufacturer. Different manufacturers or brands will have different recommendations of how many mileage or months you should rotate this or buy a new pair of shoes. But as a general rule, it's typically around 6 months to a year, depending on how much running you run per week. Obviously, if you're training for a marathon, you're going to run out your shoes a lot faster than someone who just does 5Ks. And then acute injury management, tip number 5. So whenever you get pain flare up, right, don't panic. Use peace and love protocol. So it's peace and love is an acronym. So peace is protect, elevate, avoid anti-inflammatories early on because you do want to allow the body to go through its natural inflammatory phase in the first 3 to 5 days. Now, if it's excessive inflammation, yes, you could take anti-inflammatories, but instead of relying on Advil, right, just let the body does its natural healing course. If the pain's really bad, you could do Tylenol instead of anti-inflammatory medication. Tylenol is acetaminophen, so it kind of works on different pain pathways. Yes, it has its own different side effects, but in general, do that versus the anti-inflammatories, the NSAIDs like Advil, ibuprofen early on. Then you could do compression, right? You could do like an ACE bandage or a wrap. Just learn about your injury that, hey, it can get better, it can heal. Not every injury is catastrophic. Yes, if you got a broken bone, go to a doctor. If it's like a obvious trauma, like you fell down, you were in a car accident, some obvious trauma, definitely go to the doctor. But if it's like a mild strain, like, hey, just kind of out of the blue, you're still able to walk, you're not limping, you don't have a big loss in function. Most of these soft tissue injuries do heal pretty quickly. You take some temporary break from running. I said the dirty word rest. It's okay to rest if you need it, right? Don't feel like you're going to lose all your training if you have a week off from running. You can still bike or swim as cross training. And then for love, it's going to be load gradually, optimism, vascularization, right? So that could be gentle movement and also light cardio, right? So maybe you're able to brisk walk or maybe you could bike. And then again, gentle exercise. Let's say you hurt your ankle, right? You can still do some gentle ankle movements, ankle pumps to get blood flow to the ankle. And again, don't be afraid of doing some rest if you really need to rest for an acute like tissue injury or flare up. Just allow the body to heal. It's okay to rest a week. It's even if you were training for a marathon, it's not going to really derail you. You're going to not be able to finish a marathon because you just had a 1 week off to take a little rest break to allow your tissues to heal. Right? Don't panic. Don't freak out. Tip number 6, biomechanics. Film yourself from the front and the back, walking and running, right? Look for your knee tracking. Make sure your knee's not caving in. Your foot's landing under your central mass, right? Make sure you're not overstriding. You have a slight forward lean from your ankles, right? You're not rounding forward. You're not looking like Mr. Burns from The Simpsons. You're not like looking like this. You have kind of good upright posture, right? More upright posture, even when you're walking as well. Right. And then look at your foot. Make sure you're not like excessively toe in or toe out, like no pigeon or duck walking. Try to keep neutral feet. I understand some people may have natural variations based on their anatomy, based on their hip morphology. But if you're able to correct it, try to correct it. In general, in terms of foot strike, there's going to be some debate on this. Some people say it doesn't matter too much because it's going to vary depending on the terrain, the distance. Like if you're doing an ultra marathon, you might go through all different foot strikes. Heel strike, midfoot, forefoot. But for the most part, if you're training for speed, right, usually forefoot or midfoot more, right? If you look at a sprinter's going to be doing more forefoot or midfoot striking. Yes, for distance, you may do heel strike, but for the most part, see if you can do midfoot. I know some people might debate or fight about this, but you could test this out yourself. If you are trying to go for speed, you'll find that you go more for midfoot. Now, if you're leisurely, right, if you're just walking, right, you're going very slow, you might heel strike. It's not the end of the world, but the most important thing is that you're not overstriding, right? That your foot is landing underneath you, not all the way out in front of you when you're running. And then tip number 7, smart programming. This is where most runners blow it. Either they add too much too soon or they go too fast. So follow the 10% rule. Don't increase your like workout duration, a specific workout, more than the rest of the week, right? There's also a rule for the weekly mileage, right? Not to increase more than 10% weekly mileage or time per week. You could follow that rule as well, but it may vary depending on if you're a beginner or advanced or intermediate runner. Another rule I like is the 80-20 rule, right? If this is for people who run like 5 days a week, right? So if you're just running 3 days a week, it doesn't really apply as much, but you could take the general concept of it. But anyways, if you're running 5 days a week or more, 80% of your runs are easy, 20% are hard, right? If you're older or injury prone, cap your running to 3 days a week. And then just use the other 2 or 3 days for low impact cardio to build your aerobic fitness without putting too much stress on your knees. In a 2025 study from the British Journal of Sports Medicine found that your particular running session, if it was 10% longer than your longest run in the last 30 days, that is going to increase your injury risk significantly, more than any weekly workload ratio. That's why it's more important to actually look at a specific workout and make sure that a specific workout is not more than 10% longer than your longest run in the past 30 days. So what that means is in a 30-day cycle or a month training block, you're gradually progressing, right? You may ramp up for like 3 weeks, and then maybe at the week 4, you kind of taper down, and then you ramp up again. It's like a step ladder as you ramp up, and then making sure any particular. Usually, people get in trouble with the long run, where they make their long run 1 week 10% longer than the long run of their the long run of the past week. Let's say, like, you just made a way bigger jump than you had to. So again, be mindful of that increase. Any particular workout session either can't be 10% longer or just too much volume, because that could put you at risk for overuse running injuries. And usually the long run was what most people get in trouble with. And people can get in trouble with speed workouts as well, or hill work. So like, don't do more speed than your body's used to, or more hill workouts than your body's used to. Gradually progress there too. Nutrition, right? You can't outtrain poor fueling. So undereating leads to fatigue and bone stress injuries, but overeating, right? It makes you gain weight, and then you could be overweight, obese, or overweight or obese, and every extra 10 pounds adds 40 pounds of force per step on your knees. So make sure you're eating enough to recover, stay lean, and stay strong. Stay at a healthy weight. If you're not sure, look up the BMI calculator or look up body fat percentage and make sure you're in a healthy weight for your age and gender category, just to make sure, hey, that you're staying healthy. And if you're dealing with specific running injury like runner's knee, IT band syndrome, Achilles tendonitis, join my free course for running pain free. Link in the description. I got many courses on those different topics so you can start healing today, right? So link below, and I'll see you on the inside.